This is a prone technique to restore knee flexion range of motion. It's not an arthrokinematic glide, it's an osteokinematic passive range of motion. But I use a swimming noodle. In this case, I took a swimming noodle and stuck a cord through it, a rope through it, but you can use a regular dollar store swimming noodle. I'm going to place the swimming noodle behind the knee and then bend the knee up and over onto it. So what it's going to look like is the noodle is going to be placed behind the knee joint. It's going to get pulled towards the knee joint, and then I'm going to bend the leg up and over the noodle like so to increase knee flexion range of motion. So let's get rid of the skeleton here, and I'll show you on a real leg what that looks like. So I'm going to get that noodle way into the crease of her knee. It's a two-person technique, so I'll have somebody hold the rope. You almost end up bisecting the angle of the knee with the rope to pull it towards the joint. So it's not an anterior glide for sure for flexion, but I'm just trying to pull the noodle into the joint directly. So you'll feel it as a practitioner that it's in the correct spot, because again, you don't want to give an anterior glide in this position. So I'm going to use one hand and hold her femur on the table so that I can traction her tibia kind of up towards the ceiling. And as I keep the traction on her tibia up towards the ceiling, go ahead and pull on the rope and hold that pull. I'm going to basically bend her leg up and over the noodle for a passive range of motion into knee flexion. The patient might get a stretch feeling on the front of their knee, which is kind of what we want. Sometimes the pressure back here bothers them, but as long as it's tolerable, I'll tend to go through my 10-20 reps and reassess. But it's usually quite dramatic, about a 20-degree change after about 20 reps. So nice technique.